Now, talking about insomnia, with everything that's going on in the world the last 3 months, how do you feel patients have with insomnia have handled this pandemic, and what kind of tips would you give to somebody suffering from insomnia as we go through kind of a new era?
Yeah, so one of the things we know about insomnia is that it often develops in response to a significant stress. And what has happened during the COVID-19 pandemic is that there's been a lot of different sources of stress. So folks with insomnia who are already struggling might have noticed that their sleep problems have gotten worse. But another thing that we're noticing is that people who had good sleep before are actually struggling more than they did previously. So this stress has started to cause not just worries about COVID, but in some instances, even worries about not sleeping. We don't have a lot of scientific evidence about this quite yet, but some of the evidence that we're seeing coming out of countries that were affected earlier in the pandemic are that especially healthcare workers are having persistent difficulties with sleep now.
Now, I guess talk about sleep in general with COVID-19. Are Because people are mostly working from home, have some people's sleep habits maybe improved a little? They've gotten a little more sleep?
Yeah, so that's a very good question. We've seen two things. One is that, and there was a study recently published out of Italy about this, that people are spending more time in bed, but they're rating their sleep quality as lower. So we had, and maybe still do have, an epidemic of insufficient sleep, of people not giving themselves enough time in bed to get the sleep that they need. But I think because of people's change in habits and routines during safer at home instructions, that some people have extended their time in bed a little too long. And that's why they're experiencing more broken and less restful sleep.
Okay. Now, what can the individual do who's maybe suffering from some poor quality sleep? Is there anything they could do outside of the pharmacological options to kind of improve that?
Yeah, so this is actually an important point. Because we can come up with specific changes in habits and routines that have affected people's sleep, a medication is actually not the answer. The answer is to go back to the healthy habits and routines you had before. So I'll give some specific strategies. Number one, pay attention to when you're going to bed and when you're getting up. So if that has drifted into more and more time in bed, maybe cut back on your time in bed a little bit. Get up a little earlier in the morning and go for a walk. Spend a little time doing something relaxing outside of bed before you go to bed at night, and definitely don't get in bed until you're sleepy. There are two other things that have changed pretty significantly during the COVID-19 pandemic. Number one is people are spending more time engaged with technology. So watching TV, monitoring the news. So a second strategy is to have a buffer zone that's technology free for a while before you go to bed. The third thing that's changed is that people are drinking a lot more alcohol. And we know that alcohol has a negative effect on sleep. While it initially makes people feel relaxed, what happens is it's metabolized, is that it fragments and disrupts sleep. So people should be mindful about their alcohol consumption, especially within 3 or 4 hours of bedtime, and keep that to a minimum.
Now, some of these issues we're noticing with sleep, do you think they will last as we kind of come out of lockdown and maybe things start to improve? Or will the poor quality sleep kind of get better as everything around you gets better?
I think we're going to see some of each. So I think for some people, this really is a short-term disruption in routine, and things will go back to normal once people get back into their regular habits. Um, but for a percentage of the population, and we don't have a hard number, but maybe 1 out of 10, 1 out of 8 people, this problem won't go away on its own. It will persist. And when we look back, what we'll see is that the changes in habits and routines that led to bad sleep, then lead some people to start to worry about their sleep, develop additional habits and routines that actually make their sleep worse over the long run. So this is how clinically we see insomnia evolve, is that there's often a trigger, but then it kind of becomes its own monster. And so that's an instance where we would, down the road, want to implement a treatment directly targeting the insomnia problem.